Hi, Dr. Steve Knighton here from Nottinghill Family Wellness Center. Today we're going to go over TMJ dysfunction or jaw pain in a patient, go through the anatomy and then treatment. So here we have our patient. Your jaw is basically a joint up in here that comes into the bone like this. Everyone knows your jaw is, with a group of muscles that attach off this side, and then some come down and even under the chin in here. The jaw itself does kind of two things. It opens the mouth, so open your mouth, good, and it does a little bit of translation. So there's a rotational component and an opening component. When people come into the clinic, they can have pain up even up almost at their hairline. They can have pain here, down lower in the jaw, or even in the front. Some people can open. When they do open, there's tracking problems. So what we're gonna get here is get our patient to open her mouth nice and wide, and then close, and then open again. So you can see on her, and close again, it's subtle, but the jaw does shift to the right-hand side. So we'll just say she has right-sided TMJ now. So if she opens again, I'll exaggerate it. It opens clean all the way, and then when she closes, it jumps right, and then closes that way and comes back up. So one of the many ideas of TMJ there, and everyone presents a little bit differently. So anatomy is very basic. There's a joint on each side. There's a bunch of muscles that attach to that joint that help you open and close your jaw. And then what happens is, a lot of times, if it's stuck on the right side, because it's one piece of bone coming around, not only does this joint get screwed up, the other joint starts to get affected too, because you just can't open your mouth properly. So to continue our anatomy of the TMJ, we're actually going to talk a little bit about your upper cervical spine or your upper neck. There's basically 7 vertebrae in here. I'll just draw a rudimentary size, so we got 5 in there. So what happens in 50% of our patients, and I do mean this a firm 50% of our patients, the C1 joint, which is right here, or C2, the C1 attaches to the base of the skull. That gets out of place, causing a bunch of muscle restrictions and nerve impingement in this area up in here. That in turn, some of those nerves go to the jaw, the muscles attach here and go to the jaw, get tight, cause a jaw pain. So some of our patients with jaw pain is coming straight from the jaw. Some of it's coming from just the neck. Some is coming from 50% jaw, 50% neck. So in most jaw cases, we will treat both the neck and the jaw, especially chronic stuff. It's really beneficial for the patient to get both treated. So the anatomy of this works basically like the upper neck muscles and nerves affect the jaw, which in turn can cause pain in the jaw.